All right, so I am going to do a presentation on one of the national patient safety goals. The one that I am presenting is clinical alarms, alarm safety. And we all know that clinical alarms are used in patient care areas to alert us of any change in patient status. And at any given time, especially on this floor, we can have multiple alarms going off at once. And so, due to the amount of alarms that can be going off at one time, we can develop alarm fatigue, especially if they're false alarms, if the child's parameters are just out of range, a kid moves, pulse ox doesn't work. We start looking at it and just saying, oh, silence it is fine. That's alarm fatigue. We're over it. We don't want to answer them. But that's, of course, a patient safety issue. So this national patient safety goal is of the utmost importance, again, because it does affect their safety. There could actually be a real alarm, and we think it's a false alarm. So due to the effects that alarm fatigue can have on patients, we really need to rectify this situation. I did some research, found 4 interventions that could possibly be used to help rectify the situation. Before I talk about those, I want to tell you about a situation that I had. I went to another unit and I had a patient that had been desatting all day, multiple times. So I asked the charge nurse if I could attach the alarm to my phone. She said they don't do that. They turn theirs off because the alarms became annoying. They didn't do that anymore. Okay, fine. Who am I to tell them that they need to change it? It's their unit. I went off the unit to eat lunch and received a phone call from the charge nurse that my patient was 76%. So I got to the room. Basically, no one was outside at the monitors. No one noticed that she was 76. I went into the room to help her suction and put oxygen on my patient, and she looked at me and she said, now I understand why you would want your alarms on. So that could have been a real problem if she had noticed, or if anyone else had not noticed. My patient could have deteriorated even further. I mean, we still don't know how long she stayed that low. And we could have known if the alarms had gone to my phone. So one of the interventions is to figure out monitor necessity. Which patients really need these monitors? Every patient does not need to be on cardiac monitors. Every patient does not need a pulse ox. Just because a patient comes in and they have a cough, they don't need a pulse ox. If they sat fine while they're asleep, check with the doctor, make sure it's necessary. If it is not, remove it. We had a question this morning in our meeting about RSV and the pathway with the pulse ox, and some of those pathways do not require oxygen as long as the kid is maintaining stats on air above 88. If you have a patient who is 88 and they're hanging out and that's normal for them on their pathway, it's still going to alarm all night, but it's normal for them. So that begins alarm fatigue for the nurse who has that patient. Also, discontinuation orders. If the patient is ordered pulse ox or monitors immediately post-op, they may not need it post-op day 1. They may be up moving around, their oxygen is fine, they're on room air. We should request that the doctors discontinue those orders. Or if they are going to put in the orders, to put in the orders with a duration, meaning pulse ox, cardiac monitors until post-op day 1. That way we automatically know to remove them the next day instead of keeping them on for their entire stay. The next thing is silencing alarms during patient care. If you are in a room with a patient and you're changing a diaper, you're getting them up to go to the bathroom, you're repositioning, anything that may affect the leads, just silence it while you're in there so that way it's not constantly going off. The people who are outside, the nurses who are outside watching the monitors, make it concerned if they see your patient's desatting it, it's not a true desat, and you're in the room with them. So just silence it, do what you have to do, and then unsilence it before you leave the room, of course. Next is the alarm parameters. The amount of alarms that were noted with one study One study researched the amount of alarms that were noted after slightly altering patients' alarm parameters. That means tweaking them by 5 points up or down, and it decreased the number of alarms by 43%. So that's a good amount of alarms that were decreased just by bumping up or lowering parameters. So if you have a patient who is a 16-year-old basketball playing boy who sleeps at 50, his heart rate is at 50 every night, our parameters don't go lower than 60, he's going to alarm all night long. You know he's fine, you know he's stable, but it's going to alert all night. So we need to lower the parameters or request that the physicians lower the parameters. We need to figure out how to individualize our parameters for our patients. So that's a big thing, especially for us since we have infant, child, and adult profiles on our monitors. And lastly is the alarm delays. It would be nice if we could set our alarms to a 10 to 15 second delay or 5 to 10 second delay. That will help when you're in with the patient and you are repositioning, just in case you don't silence it, and you're repositioning, or if they're in the room alone and they start moving around. The monitor does not go off immediately. It tries to self-correct and pick up. And if it doesn't pick up after that 10 seconds, then it alarms. So that kind of lets you know that, okay, this is real. It's not just them moving around or someone taking it off for something simple. So with the slight delay, it honestly could help us decrease the amount of alarm fatigue that we have. We know we have babies who kick and cry and scream all the time, and it would be nice if we had that delay just to help prevent that. So that is all that I have for my presentation. Does anybody have any questions at all about alarm fatigue or any other suggestions other than what was presented? No?
I think that was excellent.
Thank you very much. Okay, that's it.